We have some breaking news. It's from Ohio, where CNN projects that voters will say no to legalizing recreational marijuana. It is an issue that came up in last week's presidential debate. Ohio Governor John Kasich says he doesn't favor it, and here's why.
Sending mixed signals to kids about drugs is a disaster. Drugs is one of the greatest scourges in this country. I've spent 5 years of my administration working with my team to do a whole sort of things to try to rein in the problem of overdoses.
A shocking new study says the problem of drug use, alcohol, and mental illness has gotten so severe that for the first time in any first world country, the death rate for white middle-aged people is on the rise while it's declining for blacks and Hispanics. It is a finding that stunned researchers and has implications for the election and the candidates on the campaign trail. Joining me now is Dr. Drew Pinksy. Dr. Drew is an addictionologist and host of HLN's The New Dr. Drew. Also here with me, Bob Beckel, CNN political commentator and author of I Should Be Dead, My Life Surviving Politics, TV, and Addiction. Now you see why we have you both here. But Dr. Drew, I want to start with you. You know, for the first time, experts like you have known, for a long time, I should say, have known that there is a big problem out there with drugs and alcohol addiction and mental illness. We talk about it on your show and on this show all the time. But the numbers are still shocking. Why is this particular group of Americans struggling so much right now?
Well, there's 2 points to be made. I mean, one is this is not a surprise to someone like me. I've been saying for anyone that will listen, that there's a tsunami coming of these kinds of problems, that the overprescribing of opiates and benzodiazepines, the inadvertent overdosing, the mental health issues around these phenomenon are staggering and absolutely commonplace. You add to that the economic stressors that people are experiencing, and that those two together seem to be the alchemy necessary to create these staggering numbers. Precisely why this is happening and why so intensely has yet to be worked out. But I will tell you, the first culprit that I've been watching for the last 10 years has been the overprescribing of opiates.
Yeah, of opiates. We just had a conversation about that a couple of weeks ago on here. You know, we all know addiction and mental health know no racial boundaries, no age boundaries. But, you know, it's white men, white women, age 45 to 54 with high school level education. The death rates are going up. The opposite for black and Hispanic Americans in that same age group. And a lot of that is because of prescription pain pills, as you've said. This age group prescribed prescription pain pills more than any other group?
It appears to be so. I mean, I've watched this age group grow up and get older, and they were the leading edge of really a pandemic of childhood trauma and adverse childhood experiences. And as they reached adolescence, young adulthood, they looked for ways to regulate their emotions, and drugs and alcohol, and then ultimately pills, were what they were offered. In the African American and in the black and the Hispanic community, they weren't having the same kind of access to the medical system. They weren't as likely to be prescribed. In fact, physicians, there's some suggestion, may have been somewhat recalcitrant to prescribing these substances to those groups.
Interesting. Bob, I want to turn to you because one of the authors of this study are economists, and one of them is named Angus Deaton. He just won the Nobel Prize for his work in health economics, and he says that it is also because of our economic stress that household incomes for this group have fallen since the 1990s. Income inequality has been a term that we have been using in this election season. If you take that into consideration, is it not unfair here? It's deadly, right?
Oh, sure it is. And, you know, I mean, I'm a victim of it. I just came off of opiate addiction after a back operation, and I was out at a pain management center, and I watched people come in who'd never been addicted to anything. Who had gone through operations and were prescribed opiates, and as a result of that, they got addicted. But I think the bigger point here is that if you look at this demographic, this group, first of all, they're the toughest ones to get clean. I mean, I've been clean of alcohol and drugs for 14 years.
Why are they the toughest to get clean? Because
they tend to be so sure of themselves, they know what they're doing. But in this case, you know what they call Oxycontin? They call it hillbilly heroin. And it's rampant out in rural America, and doctors do overprescribe this stuff. And also drug dealers. I mean, I work with a lot of addicts and alcoholics, and I asked a drug dealer the other day when I was going into a crack house to pull a kid out, I said, how you guys doing? Because I used to buy from these guys. And he said, well, we're doing great. We're not selling cocaine anymore. We're selling just opiates.
Heroin.
Go ahead, Dr. Drew.
Heroin. And what happens is that the doctors are finally getting the message they've been over-prescribing for the last 15 years. Look, I remember 10, 15 years ago when in Florida particularly, patients could walk into a pain management organization and look at a menu and select for themselves the particular opiates they wanted. Doctors were taking the position, who are you to say what pain is or whether the pain's under control? It was insane. So now they're getting the idea that they've been overprescribing. They're taking these patients, they're looking at the patterns and going, oh my gosh, there's a problem here. You're a bad patient. I'm not going to prescribe to you anymore.
Yeah.
As opposed to bringing them in and said, we have a problem. You're an addict. I didn't intend to do this. Let's fix it. They cut them off. They go to the streets. That's where the heroin.
And that's where it happens. And listen, the candidates, we've been hearing a lot from the candidates about drug use and about drug rehabilitation, the crisis in America. Let's listen.
When I sat there as the governor of New Jersey at his funeral and looked across the pew at his 3 daughters sobbing because their dad is gone, there but for the grace of God go I. It can happen to anyone.
Look, I have some personal experience in this just as a dad, and it is the most heartbreaking thing in the world to have to go through.
I was struck by this statistic that last year, for the first time, we had more deaths by overdoses than we did by car crashes.
My husband Frank and I buried a child to drug addiction. So we must invest more in the treatment of drugs.
So they're not just responding to what they're seeing in the media. They're responding. This is hitting home for a lot of them in their communities and in their own homes. They have to address it.
Listen, I don't know of anybody that doesn't somewhere or another can trace back a problem with addiction, with alcoholism or drugs. But the interesting thing about this is this may be the first time where there's a bipartisan consensus where Democrats and Republicans have come to the conclusion that this is a very big problem. We're talking about millions of people. You're talking about millions of voters. The number of people affected by drug overdoses and the sale of opiates and heroin are enormous. And if you don't address it, you're not doing yourself any good as a candidate because it is a prevalent and a demanding issue.
Dr. Drew, you know, we talked about the crack epidemic and, you know, and all the other epidemics that hit, drug epidemics. Heroin, I think heroin mostly hits white communities. Crack hit black communities especially hard. Are we finally past the point where people look at drugs as an urban problem, a problem for minorities or the inner cities or lower income people?
Oh, sure, we're there. This last weekend set of data that came out really brings that all the way home. This is white middle class men. That's who's dying right now. These guys are getting their hands on these drugs. They're getting excessively involved with them. And there's another issue here. A lot of people talking about treatment and what we ought to do, but no one is really talking about what that treatment ought to be. I'm a little surprised that Botticelli, who is the drug czar now, is coming out so strongly for drug replacement therapies. I mean, that's an option in treatment of opiate addiction, but that's becoming the only thing people are talking about. I think that's a shame. He's a recovering guy. He should be advocating for formal recovery as well.
Quickly,
Dr. Drew, the fact you mentioned early childhood trauma, and there should be a treatment set up around that. And in fact, a guy named Dr. Peter Preskoff at Betty Ford does non-medical, non-prescription work dealing with early childhood trauma, which manifests itself as pain later in their lives. And so
you're singing to the choir.
Yeah.
You're singing to the choir. I got to tell you, every patient I treat, I tell people, if you're bad enough you need to see me, you had severe, significant childhood trauma, and that needs to be treated.
Thank you, Dr. Drew. Thank you, Bob
bet.
Beckel.
Yes, sir.
I appreciate both of you.